there are many, many important people in the field of allergy. And one of the really giants in the field is a man that we just lost recently, Dr. Theron Randolph, who dates all the way back into the 1930s. And I can remember my first exposure to him about 20 years ago was reading one of his books where he made a statement I thought was much too strong, and he said that food allergy is the most commonly undiagnosed medical condition in the United States today. 20 years later, I'm almost tempted to say that's an understatement. More human suffering is either caused by or aggravated by adverse allergic reactions to foods.
Most common allergy is a food allergy that can be shown anywhere in the body. Physically, you can have arthritis, asthma, headache. Mentally, you can have hyperactive, depression, mania. Emotionally, you can be very irritable, nervousness, anxiety. The food actually can cause all kinds of diseases.
Food allergy expresses itself in many, many different ways. In fact, there's over 200 different allergic symptoms that have been associated with allergic reactions to foods, and over 60 medical conditions that have either been shown to be provoked by allergic reactions to foods or even caused by allergic reactions. And you can start from the top of the head and go down to the bottom of the feet, the different ways that allergy can express itself, from chronic pain conditions like migraine headaches, even muscle aches, joint aches can be provoked or caused by food allergy, digestive problems, skin problems, breathing problems like an asthma, and so forth and so on. The diseases run the gamut from autism to attention deficit hyperactivity disorder to asthma, allergic skin conditions, inflammatory bowel disease, even obesity seems to have a food allergy component, at least in my experience. People eliminate allergic foods, they lose weight. They eat allergic foods, crave allergic foods, they gain weight. So it's actually the great masquerader. It seems to be reflected in many, many different ways in the human body.
Unfortunately, there is a limited benefit from the traditional approach to allergens. There's limiting testing, there is limited treatment. As you will see, it is a much more complex area than what we've been led to believe.
Traditional allergists have a fairly limited view of allergies in the sense that they look at only one type of allergy, and that is allergies that are mediated by a specific type of protein called IgE, or immunoglobulin E. And this classically mediates allergic conditions like asthma, rhinitis, which is nasal congestion, or eczema or hives. But in a more broader view of allergy, we see that it can be mediated by numbers of other immune mechanisms, either other types of immunoglobulins such as IgG, or even certain cellular immune problems. And certainly in the case of chemical sensitivities, which is not a classic IgE allergy, it can be mediated by immune mechanisms, and therefore it would really be thought of as a sensitivity or an allergy, but not in the classical sense.
So I began taking allergy injections for a few years, but the funny thing is I wasn't really getting any better. And when I brought this up to the doctor, he said, well, you know, if you stop taking the injections, all the good that they've been doing have been for nothing, and you'll be so much worse off. Do you want to take that risk? And I guess I was supposed to say, no. I dread the thought of being worse off than I am. But I really wasn't doing well at all. I was succumbing to attacks of asthma with this, only moderate exertion. I was sneezing all the time. My body aches were pretty bad, and I really wasn't getting any better.
Asthma is often treated with medications without consideration of the allergic underpinning of the wheezing in the chest, which is the target organ of the allergy symptomatology. Migraine headaches being treated with medication and many other methods which don't deal with the underlying allergic condition which is provoking the migraine headache.
The traditional doctors, they put me on Valium, suggested I see a psychiatrist, bed rest, or try to forget about my symptoms, which was very hard to do since I was not well and didn't know how badly the illness was, and it was getting worse day by day. I suffered migraine headaches 3-4 times a day in each eye. I sat up all night waiting and praying to die.
Using chemical pharmaceutical medicines interfere with our body's natural ability to repair itself. Every time we take these pharmaceuticals, whether they be for allergies or for infections or for whatever the problem might be, they actually weaken our immune system. And when we do this time after time, over and over again, we find that our immune system becomes very weak. And it takes a lot of work to rebuild this immune system.
Taking injections, and there was no real discussion of food intake and that sort of thing, which really turned out to be the main problem area for me.
I had been to a lot of conventional Western medicine doctors, and when I was a child I went for years and years of allergy shots, and when I turned 18 I just said enough of this, and I cut all that out, and basically I noticed no difference whatsoever. The doctors would talk about things like depression and want to prescribe a lot of psychopharmacological drugs, and I pretty much just didn't do any of that stuff.
Food allergy is a controversial subject primarily because there are people who define it differently. The conventional group, dating all the way back to the 1920s, I think very arbitrarily decided to define it as an allergic reaction involving 1 or 2 foods in the diet that could be picked up with a skin test or a blood test looking for a specific type of antibody, and basically only affected certain systems of the body. If it didn't affect the skin, if it didn't affect the digestive tract, it didn't affect the breathing, it wasn't a true quote-unquote food allergy. Many authorities today are challenging that definition, and the definition has broadened to include a whole group of reactions called delayed onset food allergy, which basically can't be picked up with a skin test, cannot be picked up with a conventional allergy test called the IgE-RAS test, and affects basically any system or tissue of the human body. So you have these two camps, I think both well-intentioned, who disagree and create controversy because they can't agree to what represents the proper definition of the term food allergy.
In conventional medicine, we really look at dealing with symptoms. We do disease care. When symptoms present, we try and get rid of them. You know, in a more natural approach to medicine, we try and understand, why do I experience the symptom that I'm experiencing? I practice what I call integrated medicine, which means that I don't have only one system that I use, that I look at people's whole lives. I look at their diet, I look at their emotional state, their stress level, and their medical story.
The typical allergic reaction that everyone's familiar with is the overt allergic reaction when somebody eats a strawberry and they get a hive, or they have shellfish and they have an asthma reaction. That covers about 25 to 30% of the population that has those kind of overt allergies. They're the kind of allergies that show on skin allergy testing, when the doctor will inject into the surface of the skin some portion of that allergen and there would be a skin reaction. Those allergies are IgE-mediated allergies. They're immediate reactions. People usually know what those allergies are and they try to avoid it. The more insidious, less obvious allergies are the IgG-mediated allergies, which are the allergies that elicit an immune response. The immune response is an antigen response which compromises the immune system, and the immune system is producing antigens and antibodies to harmless substances like foods, and our armies are going to work for things that aren't that important, like foods.
The patient can test themselves via 2 basic methods. One is to remove the food for a period of about 10 to 15 days and then to reintroduce the food as a mono meal.